Okay, so undescended testis is a condition when the testis is not in the scrotum. The testis normally develops inside the abdomen, and it develops where the kidneys are in the human body. However, they descend into the scrotum usually before the baby is born. If the process is interrupted, then the testes don't reach the scrotum, and that is when we find undescended testes. Yes, the exact cause of undescended testis is not known. Most boys with undescended testis are usually otherwise normal. Uh, it is more common in premature babies who are born before the testis is completely descended. Uh, Sometimes there are some genetic and hormonal factors which can play some role, but generally there is no real cause that has been identified for undescended testis. Okay, if a baby is born with undescended testes, immediately after birth, no treatment is required, as the testes can continue to descend up to 6 months of age. However, surgery is recommended before the first birth. There are generally two reasons for that. One is the testis is supposed to stay in the scrotum, because the temperature of the scrotum is low and it helps in the testis producing sperms. So if it remains high, then it eventually will lose its capacity to produce sperm. The other thing that we also know is that if the testis is not in the scrotum, it increases the chance of developing testicular cancer. So the operation is essential in the first year of life, as it decreases the chances of developing cancer in future, and it also improves the ability of the testis to produce sperms. No, undescended testis is generally not an emergency condition. The emergency condition is if the undescended testis twist, which is called the torsion of an undescended testis, when there is a painful lump in the groin. If that happens in a child whose testis is undescended, that would require emergency surgery. Unfortunately, in most cases, the testis is lost by the time the surgery is undertaken, but it can be saved as well. So if undescended testis itself is not a condition that requires emergency treatment, however, if it twists in the groin, then it will. Okay, so as I said previously, that if we don't operate, the testis may lose its function and the testis might develop to a tumor. So both of this can be avoided or at least reduced by doing the operation. The surgery, what we do depends on the position of the testis. As I said in the beginning, that the testis develops where the kidneys are, and then they come down to the scrotum. If the testis is close to the scrotum, say in the groin, which can be felt, but not exactly in the scrotum, then we do the operation in a single stage. That is a one-day operation. As a day case, the child goes home on the same day, where a small incision is made on the groin to free up the testis, and another small incision is made in the scrotum to fix the testis, and the testis is tunneled under the skin from the groin into the scrotum. And this is the most common condition in undescended testis, where the testis is actually felt in the groin. Sometimes the testis is not felt in the groin, and in those situations, we do a keyhole operation to the belly button and see whether the testis is inside the abdomen. And in those situations, the operation will depend on what we find. If the testis is inside the abdomen, then the operation is usually done in 2 stages. In one stage, the testis is mobilized inside the abdomen, and in the second stage, the testis is brought down into the scrotum. Usually, there is a period of 6 months between the two operations. There are situations when the testis is not developed at all, or it shrinks into a small nubbin. In those situations, the testicular nubbin is usually excised, as they don't cause any, they don't have any function and can cause problems.